glad I'm at the end.
All right, well, hello, everyone. I think we can go ahead and start. Bill may or may not join us. I didn't hear back from him. So the first order of business is to read the open meeting law statement. Do you have that in front of you, my dear scribe?
Oh, I do indeed. Yes, the public is welcome to attend this meeting in person. Zoom link to access the meeting remotely is also available. Please note that the in-person meeting will not be suspended or terminated if technological problems interrupt the remote connection. And I am not going to read all the numbers for the various links.
All right, thank you. And then we'll do a roll call attendance. I'm Lynn Jackson. I'm the chair of the Biosafety Subcommittee.
Eric Kaplan, member of the Biosafety Committee and Board of Health.
Dominique Curley, Public Health Director.
And Maggie Rosa, scribe via Zoom.
Thank you all. So our next item of business is to review and approve the minutes from the last meeting, which Maggie put together for us. So thank you, Maggie, for that.
I make a motion that we accept the minutes from the last meeting.
Fabulous. A second?
Second it.
All right. All in favor? Lynn Jackson.
Eric Kaplan, yes.
Dominique Curley, yes.
Maggie Rosa, yes.
All right. And so next was just to review the action items from our last meeting. And a couple of those things were from Vicky, who sent us a note after she made the changes that we asked her to change. And she said she was still waiting for an approved statement about.
Oh, I saw that.
Yeah, so does that come from the City of Gloucester legal, or where does that actually?
Is that the question that you have with regards, like, you know, this is, you've given us, if you give us your IP, it's your problem. And I hope that it wasn't on my list to check with legal or not on that, but I certainly will if you'd like me to. Was I just checked with legal?
I don't know. I didn't see that anybody was particularly tagged for that in the minutes, but obviously it's something that
I'm happy to do it. In fact, I can send him an email as we speak, see if I get a response.
Yeah, that Vicky needs. And then the other thing she asked for was pop-ups for the 3E, D, and F.
I remember that.
Do you remember that?
Yes.
So were those supposed to be pop-ups that just gave the definitions for what falls under those?
It's like rollovers
sections? Because Maggie, I know you put in the minutes here, which we discussed last time, that, you know, and that's under clarification of NIH guidelines in the minutes, that the subset of experiments under 3D are also exempt provided they fall under section 3F. Blah, 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 if they also fall under section 3F. So isn't 3F really just what we need for this registration?
I think the gentleman that was here last time said that if F and C overlap, then that part of C, then that's also included, and F and D overlap, then that's also excluded.
Yeah,
and so I think
his
that
Venn diagram there.
Yeah, the Venn. I think
But she wasn't going to do the pop-ups until she got more information about the pop-ups. That's what it says on D. Vicky will wait for information about pop-ups. So I don't know if anyone was supposed to send her that information or not. I know we discussed it, and that's what she said, is she wouldn't do the pop-ups until she got more information, probably from someone here.
Did we mean by that we were just going to put in links to the NIH guidelines for each of these for 3F?
I think that's what
3 D or whatever it is.
I think she was
3D,
confused.
2A was all.
She was probably as confused as we were.
Yeah,
And so that's why she didn't put in the pop-ups yet. She needed to have some more clarity.
yeah, I seem to remember that we were just gonna have her put links directly to those sections of the guidelines.
Yeah.
So that if the applicant had questions about it, that they would, just be able to click on the link to that section and refresh their memory as to what was included there.
But the reason that she didn't want to put links at that point, I think she said, was because it tends to make people,
Make it
result in
slow
people
down.
reading the application and not coming back. So maybe that was why she wanted some text. But if you just say, please refer to the NIH guidelines in a statement and not include a text, include a link, wouldn't that work?
Because we already have a link to the NIH guidelines in the beginning of the application.
Right. So you could see, just please refer to NIH guidelines and leave it at that.
Yeah, what he had told us was that if it's 3D 2A, or if it's 3D, I think it looks like YC chapter 2 or 3E 3A, all of those situations, it can fall into 3F.
Yep.
And there's gonna be sort of a scroll over to talk about that.
Yep.
So,
Well, I can certainly just give her language to refer back to the link to the NIH guidelines that's already in the introductory section.
As Bill said, people will have to do their own homework and then we get to review it,
Yep.
right?
Okay, so on that, Dominique's gonna follow up on with legal on an appropriate statement for if you provide any confidential or proprietary information, we're not responsible. And I can send a note back to Vicky with some text.
Yeah.
For her to add into the actual application. To reference those specific sections that were clarified for us by Bill at the last meeting.
Yeah, I think that's good enough.
Let's see. What other follow-ups did we have?
She already sent us the email.
Yeah, Vicky already sent us the email, and actually Lee printed that out too as well for us, just the overview with all of the information that is in the application. So I think probably one of the follow-ups that we can do is to just go back online and make sure that everything's working the way it's supposed to work. Although I'm sure Vicky has done that as part of setting this application form up. Because I think those are the last two pieces that we need to finalize the registration application. I don't think there's anything else that we need to finalize that. So when I send her my note with the text, I'll just ask her, when you have finished these final two things, the note from legal and the reference to the appropriate sections of the NIH guidelines for registration, then I should be ready to go live. Is there anything else that you can think
We were
of?
pretty close the last time, so.
Yeah,
As long as we get these few other things done, I think we're done.
yeah, I don't really think there's anything else that we need to do, so I guess I can just tell her at that point that she can make it live and we'll, follow all the processes that we discussed last time.
I'm sorry to ask this question, but where in the document is the place where we would have the, if you give us your IP, we are not liable for the release of it? Is that on any
There
specific
is a
section?
section in the beginning that she showed us last time that she put in big bold letters that says, please do not include any confidential or proprietary information.
Yes,
I would think just putting it right after that,
if you do
to
that.
just say, and if you do,
Right.
too bad, we're
No
not really.
liability for your IP.
It's
Yeah.
on you.
I mean, that would seem like the logical place to me. Maggie, any other thoughts?
No. I'm fine, thank
Because then it's
you.
all together in one place and,
Then
you
it's
know,
on them.
and maybe that statement should be in bold as well.
Okay.
To catch people's attention. But yeah, I think that would be the best place to put it.
Yeah,
And then Maggie, you were gonna follow up to send Vicky the draft permit application that we had put together. So
I
I see
did.
that you did that.
I did, with a little note of thanking her for her
Yeah.
extraordinary efforts.
Yep. So I guess the next question, I don't know, Dominique, if you have any clue on this or not, is do we have any idea what the time frame might be for the first draft of the permit application? I know her plan was to use the registration application kind of as a template.
I don't know what her workload is, so
Because-
we'd have to ask her.
Okay,
Yeah, I don't want to speak for the IT organization.
okay. So I will also ask her when I send her my other note, if she could provide us with, you know, an anticipated timeline for producing a first draft.
I know that she works very quickly, but I just don't know what else is on her plate, so.
Yeah, oh, exactly. And I've actually been yelled at before by the head of IT who said committee members aren't supposed to be speaking directly to members of IT.
Yeah, Ryan, though, he'll be so responsive, so it'll be helpful for you. No, it's trying to
I
make
had
sure
an
that we can stay
electronic
focused.
hand slap
Yeah.
there. So at any rate, I'll just try to see if she can give us, you know, an approximate estimate
How many-
on when that would be up and running.
There are too many rules.
Yes.
I'm learning that. I'm getting lots of hand slaps.
Typical government regulations.
All right.
Slightly crazy.
In terms of the follow-up on GMGI, I did send to Sam that clause of clarification that we got from Bill on the different sections of the NIH guidelines, just to make sure they were clear on that. And I think, Dominique, you were going to follow up with them to see if you could assess how much overlap there was between their sort of general safety SOPs and those component parts that would
I have
apply
not had a chance
specific.
to do that, I'm sorry.
Okay,
I apologize for that.
no
I can do
problem.
that before our next meeting.
All right.
There was something in there about they would have to document whether their experiments are exempt or not. Their IBC. I didn't think they had an IBC originally when we first talked to them.
Well, we said
didn't,
last time
yeah.
that they were still working to gather members, but that Dominique was going to be.
They have an IBC together,
They do.
and they have the open role that they're gonna be pulling in from the community.
Mhm.
And they're talking to Chuck, who's our head of conservation. I think I told you that last time.
Yep.
And they're also talking to the, I think the right hand of the Shellfish Commissioner, who's a woman I don't know, but she's got a nice background that they really liked as well.
Okay,
So that's sort of, I'm not a member in that level, so they're kind of reaching out and seeing who's interested, and then I will, and then the mayor ultimately will appoint, I believe, based on their recommendation.
yep,
So,
Okay.
yeah.
no, I
and-
don't think the mayor appoints the IBC. I think they pick.
No,
They-
they,
yeah,
they
they
appoint
pick-
their own
Yes.
IBC. And then I think the point that Bill made last time, which I think Eric was just bringing back to our attention, is that the IBC will actually need to meet and review their application for
Yes.
using recombinant and synthetic nucleic acids. And it's the IBC that will actually make the determination of whether it falls into the registration category or into the permit category. Although Sam and Bodnar, what's her first name? Andrea Bodnar, the chief scientific officer, seem to both be confident that it will fall into the permit category. So, I mean, I could certainly follow up with a note to Sam and just say, hey, how are you doing
Yeah,
on,
what's
you know,
happening?
constituting your committee? And just a reminder that your committee will need to meet, and that probably means your committee will need to have application forms for the
Yeah.
scientists to complete. You can find those on the web all over the place. I mean, there's plenty of generic forms, so they shouldn't need to reinvent the wheel on that.
No, since I'm gonna be speaking with them anyways, do you want me to just bring that up?
Sure.
And ask them, okay.
Sure. Because the other thing that we must do as a committee is to review their IBC meeting minutes. So as part of the application, we're gonna need to review the meeting minutes where the IBC states that, you know, this work falls under the registration application for the city of Gloucester, and, you know, we will pursue that, or it falls under the permit application for the city of Gloucester, and we will pursue that. All right, and then the other order of business that we wanted to attend to at this meeting was a review of all the information that Dominique had kindly provided us in her search through LinkedIn to try to find candidates for the replacement of Lynn Klotz's position on this subcommittee. I went through all of those, and I hope everybody else did, so that we can have a discussion. I think the other question was, do we know for sure that this has to be a Gloucester resident? And I think we all assumed that it had to be.
Yeah.
Yeah.
And I believe that I spoke with Jill, and forgive me for not documenting this. I believe I spoke with Jill, and it does have to be a Gloucester resident.
Okay, which is, I think, what we all assumed anyways.
I'm sorry, I did not get that. So does it have, is it going to be yes, no? Does the person have to be a Gloucester resident?
Yes,
Yes.
Okay, there, yeah, as I thought. Okay, good. So to that end, I don't know if anybody else, but I looked at the residents list of, and so found a few names on this list that did not appear to be Gloucester residents, at least unless they were recently Gloucester residents. So
Yeah, Maggie, again, all I did was put, like, their profile had the name Gloucester as
Right.
the location, not as their business location, but as their location. So it, you know, maybe they hail from Gloucester, who knows? But that was just, I just tried to sort of deliver a short list.
Yeah.
I'm not surprised if they're not all from Gloucester.
Yeah.
So
The other thing I noticed is that none of them listed, which quite frankly is a minor thing and probably wouldn't be listed on LinkedIn, that they've actually sat as a member of a biosafety committee
Yeah,
member, or, you know, have experience on biosafety.
not something I
committees.
looked for. I just looked for the
Yeah.
background in biochemistry or
So-
cell therapy.
So I did some kind of generic searches looking for biosafety officers, looking for, you know, I used biosafety committee
Smart.
members, you know, using other keywords to see if anything else came up. Zero.
Oh, really?
wow.
And I, like I said, I suspect it's probably because for anyone's job, unless you are the head of biosafety for an institution, it's a small part of your, you know, your job description.
You wouldn't
not a
necessarily
not a
make it to
significant part
LinkedIn.
that you would necessarily put on, you know, LinkedIn, for example. Some of these individuals do have certainly the appropriate educational background, you know, PhDs in molecular biology, and that sort of thing. Some of these candidates, I think, especially the ones that are like ex-CEOs, chief medical officers, or heads of R&D, I can't think of a single time in my career when someone at that level participated on an institutional biosafety committee. So I'm thinking that
Overqualified?
I mean, what I was looking for, just to be candid on this,
Yeah.
and I have no opinion, so I'm just like, I was trying to help out here.
yeah,
I was looking for people that had been in enough industry that they had some seniority.
Yep.
That had the background in either cell therapy or biosafety, and that they looked like they had interesting skills to bring to
Yes.
the situation when they would be evaluating or considering the dynamics for, permitting.
Yep.
I didn't necessarily look for,
Yeah.
biosafety, which I didn't even think of that, which tells you my ignorance here, but again, I was actually looking for a more senior person. So it wasn't until the gentleman was here last week saying like, oh, it would be fine to have somebody more junior, that I wouldn't think of a junior person on a board. I would normally think of somebody more seasoned.
Yeah.
So that was my limited thinking there.
Although I think his point was well taken, because those are the people that are actually in the lab doing this stuff.
Yeah. Exactly.
And, have great familiarity with, what's involved and whatnot. So I took some notes on individuals that I wanted to make comments about. I don't know if we want to just start from the top of the list and review them, or.
Well, is there anybody that we should throw out, Maggie, because they weren't on they're not a resident from the nosy
Oh,
book?
if I, Steve Anderson, the person at GMGI, I would not, I don't think lives in Gloucester. There's Chad Aranio, Joseph Carroll, and Alyssa Sanfilippo. And as they have extraordinary reasons to be considered, we could follow up with them to see if they did live in Gloucester. But at a first, I would not worry about them.
Yeah, I suggest that Alyssa Sanfilippo is primarily an in vivo pharmacologist, which is very similar to my background. So it seemed like
Overlap.
We should, try to find somebody who had different expertise. So I had actually deleted her based on that.
Eh?
So you said Joseph Carroll. Actually, Maggie isn't a Gloucester resident.
Yeah, Joseph Carroll somewhere. Where is he? Below Steve Anderson. He's a strategic consultant, biotech.
Yeah. So Andrea Rogosin, who has a BS in molecular biology and actually interned at New England Biolabs from 92 to 95. Suppose I could reach out to Bill and see if he remembers her and whether she might have been involved at all in their biosafety committee. So I'll just make a note to reach out to Bill and see if he knows her personally. Because I think during that time, Bill was still at New England Biolabs. Anthony Quinn, this was the sort of high level guy, consultant, ex-CEO, chief medical officer, head R&D.
Of IDB. Of IDB. He's the owner of IDB.
Yeah.
ID Bio.
Yeah. I mean, he's certainly got the right education and training. I mean, his PhD is in molecular oncology and he postdoced in a genetics lab. His BS was in general pathology. Again, certainly a higher level person that I suspect, at least in the latter part of his career, probably didn't have a lot of direct work with, molecular biology, but who knows? He's a consultant, so I suspect that means he's retired, which means he might have time, to serve on a committee. So I guess my question on him was, is that somebody we would want to reach out to and just start exploring a little bit about whether or not he might have interest and relevant expertise. Because I'm certainly happy to do that.
Maggie, do you know Anthony Quinn, Tony Quinn?
Yes, I do. He doesn't
Okay.
seem to be around a whole lot. He's lives kitty across the street from us. He is retired, but I don't know how active he is in terms of his consulting. It's that's all I can say about him. He probably, he might be interested, because I tend to think that somebody in this, that's retired or close to retirement, and there are a few, might like to stay involved in some way, shape, or form.
Mhm.
And then,
Because you already know him, would you want to reach out to him and just get
I
a
could
sense of whether or
certainly,
not?
reach out to him. I think that what we should do to make life easy is draft some kind of a letter for all of these potential, I presume we're going to have several potential candidates. And I think we should have some kind of standard letter that we send out.
Sort of like introducing.
Well, yeah, absolutely. Yeah.
Okay,
What our mission is, what, who we are, and whether you'd be interested.
because we have some of that on the website because remember, we had to put together a short description of the biosafety committee. As I recall, it's pretty short and concise, but if you think we should expand on that, I mean, I would volunteer to put together a little more detailed information that would also include expected time commitment and that sort of thing, which I
Yeah.
think.
I don't
Yeah.
think that would be useful, because then we don't miss out anything, if
Yep.
somebody says, oh, I would have volunteered, but I was thinking it was going to take so much time.
Yep.
And then we can put in there also, if they're interested, they should send their resume and request to the mayor's
Yeah.
office, right?
So I don't know, do we serve as an intermediary to look at those, or would those go right to the mayor's office? What do you
Well,
guys think?
ultimately, if we have a recommendation, what that person has to do is apply to the mayor's office
Right.
with the CV. So,
Right.
however you'd like to operate
Yeah,
before that point, if we want
Well,
to
we should look
vet
at it
them
first. I think we
first.
should look at it first.
yeah, I'm accustomed to senior people wanting other appropriate people to vet things
Yes.
out and make recommendations, so.
Great point.
So we can certainly ask them, though, to send a CV. Well, actually, this is what Joe did to me. I think he just made it up. He said, please send me your CV and a letter of intent
So you probably forwarded that
to
to the mayor.
to serve on the biosafety committee.
As far as the time commitment, I think the biggest time commitment is almost done now, once we get the permit done.
I agree.
The rest of it's gonna be when we get permit and registrations that we have to review.
Yeah,
And that's gonna be very intermittent, I would suspect.
Yeah,
So
yeah,
time
I
commitment is
agree.
not gonna be a huge amount.
Yeah.
Unless all of a sudden we have a whole bunch of companies coming into the town.
Yeah,
which I-
well, we could hope,
And the
but
length of term would be important, since they're filling somebody's position. I can't, whatever Lynn Klotz's length of term is.
Oh, thank you. I can look at that really quickly.
yeah, Dominique did send us a note to
Yeah, and-
clarify
yeah,
that.
Thank you. Fine.
Was it February 2020?
I think so, but let me just look, so I don't have to send another note. I just want to be accurate.
He was so organized.
Oh, I'm really,
I'm
thank you
very
for saying that.
impressed.
That makes me feel good. If I was organized, I wouldn't have had to send a clarifying note.
I know I wouldn't have that in my computer at all, so.
Well, I'm just going to the website right now because that's where it's listed. Biosafety.
I do remember you sent us a note of clarification on that. There are just so many emails in the world.
I get over 200 a day. So that's why I miss things sometimes. I just can't find them all. I try to do all the
I'll tell
ones
you a
that are
story someday
important.
about my Vertex
The
days.
stuff you send me, Maggie sends me, Dominique sends me, those I read first, and then the rest of them,
Yeah.
mostly I
Oh, I'm
erase.
glad that I make it to your reading.
Yeah.
February 15th, 2025 is, would be the term.
Okay, February
February
15th.
Yes,
2025. I thought it was
So
February
we- a year
2025.
and a half.
Perfect.
yes.
So I can include that as well. Okay, so I'll take this as my action item and put something together. And, you know, I can send it out for review in advance of our next meeting. And then if people have suggested edits or whatnot, we
You
can
have
discuss those.
two already, two. How many of the ones we've just talked about? Quinn.
Oh, in terms of the
Quinn-
people?
Quinn and one other.
So
like that.
Andrea Ragosin, who actually who has a degree in molecular biology and actually worked at New England
Right,
Biolabs.
that one,
I was gonna reach out to Bill
right, see,
first to see if he actually knows her, because I'm pretty sure he was at New England Biolabs during that time period.
if he likes her, then we should send this letter that you're gonna write
Yeah,
to her.
well, Bill, I think, has a pretty good sense of this committee, you
Yeah.
know, since he participated for a long time. That was really just to see if he had any additional information to share, and he might be able to confirm whether she lives in Gloucester.
Yeah.
Was there anybody else that you found interesting?
Well,
Oh, go ahead.
go ahead, Maggie.
Have you finished your analysis, Lynn? Of these people?
No, I actually have some comments about some additional folks that I made.
So do you want to let us know?
Why'd you get through the rest of the ones you have? Right.
Okay,
This is suspense here, Lynn.
Janine Ferrant Orguetas, I know lives in Gloucester because I've been to her house.
Oh.
She's been at Biogen for 27 years, and that's where I met her. I was there for 15 years. And she does a lot of biochemistry and molecular biology. I don't know specifically if she's ever served on the Biogen IBC. She didn't when I was serving on the Biogen IBC. But because I know her, I would be very comfortable reaching out to her and, you know, assessing her interest. And like I said, I know she lives in Gloucester.
And are her skills the same as yours or different than yours?
Different than mine,
Okay.
because she's really more of a biochemist and a molecular biologist.
Great.
So that would be certainly relevant to the things that we'd be reviewing as part of this committee. You know, Maggie is our resident molecular biologist, you know, on the committee. But Janine is still working, so still very much involved in, you know, all the new things that are going on in that field, which will probably apply to the applications we'll be looking at.
Mhm.
So is she still working?
So as far as I know, her LinkedIn profile said she's been at Biogen for 27 years. So
Because a friend who knows her and had a conversation with her recently said that Janine was interested in getting involved in the Gloucester Biotech Academy. So that makes me think that maybe she is either retired or approaching retirement.
no, it could be.
If she's looking,
pretty
I
much
mean,
a high
she's not
vintage.
going to be
Retired.
volunteering at GBA until she's got time on her hands.
Right. So at any rate, I would put her in the, you know, in the candidate bucket, if you
In the
will.
mix.
Yeah.
Joseph Carroll.
I took him out
Oh, that's right. You took him out because he's not a Gloucester resident.
as
Okay.
far as I'm aware. I mean, as far, he's not listed, at least in the my recent book. Okay.
Yeah. And there's a few I didn't mention because I just ruled them out on the basis of the description. Some of those folks were clinical regulatory people, which I know is very far away from, research level molecular biology.
Yeah, probably the reason
Um,
I was picking on them is that from the regulatory standpoint, they
Yep.
have comfort in working in a regulatory environment and all that, but I suppose anybody from the industry would be.
Absolutely,
Yep.
absolutely. But their regulatory environment is submissions to the FDA more than, it's a
Yeah.
very different level, I think.
Mhm.
The last individual was Mark Candle, can't read my own writing. So he's
Yes.
a science liaison at Allergan, which is a biopharmaceutical company targeting diseases of the eye. He went through the Harvard MIT program. He has a PhD in biochemistry, did a postdoc in gene therapy, and a postdoc in genetics. So he's got the right, scientific educational background. Again, no other information if he's a medical science liaison, those are the people that liaise between the physicians and the researchers as it relates to clinical trials and biopharmaceutical development, which is a bit far from the bench, but he's got the background. So what were your thoughts, Maggie, on this?
Well, he fell into my positive list. His age, he's 63, which to me means you might be thinking about retirement if you're not already retired. And I have the feeling that he is community oriented, so that's a positive. I've just realized that I know somebody who no doubt knows him, so I could ask, just, get a take on whether this, whether this other person would think he would be a good addition to a city subcommittee. So I could do that.
Yep.
It seems like this must be a very small community of people, since everybody seems to know everybody else.
Well, it's
Yeah.
Gloucester, so. Oh, you mean the biotech community? Oh,
Well, yes,
definitely.
this
Yeah.
the
Yeah.
community seems to, everybody knows everybody, seems like.
Yeah. Well, the greater Boston, Cambridge
Yeah.
biopharmaceutical community is pretty tight, I think.
Everybody has worked in every company kind of.
That's
thing,
right.
so
We've
yeah.
all worked with each other at some
Yeah.
point in different
That's
companies.
pretty remarkable.
And
to
so that leaves us with Andrea Ragozin, Anthony Quinn, Janine Ferrant Orgaitas, and Mark Candle.
So 4.
So
Well, we also had, sitting at the very bottom there, Bonnie Fendrock, the CEO of Cyta.
well, maybe I didn't scroll down far enough.
And I don't have her bios in there, but I found her and that I know she's a part of the community, but I was wondering if she's like located near here, if that would be an issue or not. And then when I talked to Joe about it, frankly, he was saying people could always recuse themselves if something came up with their own firm,
Mhm.
So that's another option. And Maggie, I believe you know Bonnie as well, right?
Yes.
Rock. It's so interesting that when I put them at the bottom, because I'd seen them and thought like, oh, this could be interesting, but is there a concern because their local firms are local as well? But if it's not a concern to have their firm sort of involved and recusing themselves, then she could be an interesting candidate as well.
Yep.
And you want to elaborate on Bonnie, Maggie?
Oh, she's a very energetic, intelligent person. I think she could be pretty good. I think she could be pretty good, yeah.
So what's her career background or area of expertise?
Oh, I think well, I know she started a lot of, I think she started a lot of companies. I don't really, I don't know her so well, but she's involved with GMGI, as far as I'm aware, on one of their subcommittees identifying business opportunities, fundraising, something like that.
So potentially somebody who might know about new companies coming into Gloucester.
That's an interesting.
That would be an advantage for us.
Now I'm drawing a blank, but is she related? Is she married to? Oh, hold on a moment. I have to get my copy of the nosy book. Alan Dandria.
She's so her background, she's at CITA, obviously as the CEO, right? An advisor at Red Sky still. She was in Info Bionic, also an advisor there. She was a CEO and co-founder of Heprogen Corp. That was back in 12. She was a strategic advisor, to MIT. And let me just go back into her.
She's been a busy.
Yeah,
She's fairly
been around.
Yeah.
Genetics Institute, project manager for the Genetics Institute from 86 to 88. Senior research technician at Centocor, research associate at Integrated Genetics from 82 to 83. So she was in the early days there.
Yep.
Research tech at Mass, MIT.
Yep.
VP at Genzyme. But primarily they're launching more surgical products than she was launching anything genetic. So she sort of had a background in it.
Mm-hmm.
It's pretty impressive.
In vitro, so Heprogen, where she was a CEO from 2007 to 12, they create commercial tools offering in vitro toxicity and metabolism screening products.
Yep.
She is a person who I think would be is a no-nonsense person, and cuts to the chase. We like that kind of person.
Yes, we do.
And yes, she is married to Andrea. What's his name now? I've lost it. Alan Dandria, who's he lists himself as a pediatrician. I think he's Dana-Farber or something like that. So,
What do you know, Eric?
What's his last name?
Dandria, Dandrea.
Doesn't sound familiar.
Okay. And let's see. She's what? How old is she? Let me see. 58. So she's what's that? 42, 60.
I stay in my seat.
I want to get the nosy book though.
Huh?
I want to get the nosy book.
How do you get the nosy book? Well, what you should do is, if you really want an online version, probably you contact the city clerk's office.
And is it called the Nosy Book?
No, well, everybody knows it's the nosy book. It is officially the list of residents as of January 1 in whatever year it's published.
So Bonnie is a resident. We know that, a resident of Gloucester.
Yeah. She lives on Beach Road.
Okay. All right.
The nosy book.
Yep. So, yeah.
How many people live without it?
I think if you're running for office, it's probably really important.
I had no idea.
Yeah, existed.
Right.
Nobody didn't know it existed either, I have a feeling.
No.
And I mean, did anyone uncover any other candidates in their thinking about this replacement?
So, Lynn, I didn't catch what you thought about people who were in regulatory affairs. You dismissed them. You didn't think they were potentially useful.
Well, I think in terms of their background, the descriptions were all regulatory affairs in
Yeah.
biopharmaceutical development, which really means regulatory affairs related to submissions to the Food and Drug Administration, which could include both preclinical as well as clinical trials for new drugs and devices and whatever. It's a very different world than research.
Okay.
So I just
Yeah.
thought it was not as good of a match as some of these others that we've talked about. Do you feel differently?
Right. Okay. If we've got 4 candidates, that's a good start, right?
We have 5. Andrea
And
Rogozin.
5 actually with, and possibly 6 if you include Bonnie. Yeah. Right.
So I
So we
think,
got-
we definitely have some candidates.
Yeah.
So, and like I said, the additional searching
Who
that,
is the 6th? I've got Bonnie, Anthony, Andrea, Janine, Mark. Who is the 6th?
Well, let's see.
Andrea,
Let's just,
Andrea Rogozin, Anthony.
we've got Janine, we've got
Ogatas.
Rogozin, that's 1. Mark Caddle is 2.
Janine.
Janine is 3. And
And then
maybe Anthony, Tony Quinn is 4 and Bon is 5. Is that it?
Who am I missing?
Andrea Rogozin,
Got her.
I've got her.
Anthony Quinn, Janine,
Yeah.
Mark Candle, and Bonnie.
Yeah,
5.
5.
5.
Okay.
5. Yeah.
I think that's a good start.
I think it's a good start too.
I think any one of those that agrees to do it would probably be
Yeah.
fine.
Yeah, the biggest part of this is agreeing to do it.
Yes, right.
And
Yeah.
what will your salary be or your
Yeah, right,
your
yeah, right.
compensation? Well,
Maternal love. Maternal love from folks that you're gonna be helping.
all
It's a
right,
lot of
so
job.
I will write up a brief description of the committee's work and all the things that we
Just put an
discussed.
addendum on the one that's in our page, in the city document. You already have some, like you said. It's already, just add to it, that's all.
Yeah, oh yeah, absolutely. I
Yeah.
would just add to
Yeah,
the,
just
you
add
know,
a
the
little-
brief
yeah.
blurb that we have on the website.
Yeah.
Yeah, and just provide a little bit more detail.
Yeah.
And I can send that out in case anyone has any suggested edits or whatnot. And then I think we've identified who's gonna reach out to who.
And I'm not on that list of who's reaching out to who, between you and Maggie.
I think Maggie,
Sorry.
you and I are
And Bill
reach out people. Yeah, I'm gonna reach out to Bill.
can reach out to that one.
Yep. And when I do reach out to Bill, I will just ask him if he knows anybody else in Gloucester that could be a candidate. But he's an Ipswich guy, so. And
I'll
then,
reach out to Ted Costa about Mark Caddle. And also ask him if he knows everybody in town, so see if he knows anybody else, you know.
if you're much better connected than I am.
There was another guy who lives on Hesper.
Because I think, are we allowed to do anything by email?
Yeah.
Yeah, because I'd just say if anyone's got edits or comments, we could just edit that, that
Yeah.
description online, and then you and I could start reaching out, Maggie, to the people we've identified to reach out to, so that at our next meeting, we can have a discussion about
Yeah,
Were they interested? Were they not interested? Do we still have 5 candidates or do we now have 2? You know, that kind of thing.
Yeah.
And,
what was the youngest, Janine? Oh,
all right, and I think,
So again, it's not a temporary replacement, it would just be a replacement, right? Serving
a
out the term.
replacement with a term that would go to February 15th,
Yep.
2025. Right. And I'll put that in the blurb so that they understand the time commitment. All right, so that was really it for the agenda. Does anyone have any new business or anything else to bring up at today's meeting?
Good.
no,
I'm good.
You're good? Everybody's good?
okay.
Do I have a motion to adjourn?
So moved.
I second it, yes.
All in favor, Lynn Jackson?
Eric Kaplan, yes.
Dominique Curley, yes.
Maggie Rosa, yes,
All right, this meeting is now adjourned. Thank you all.
thank you.
Thanks, Maggie.
Hope you feel better.
I'm sick all the time.
No, it's